evening. Did the state and Metro health departments do enough to stop an outbreak of coronavirus at a Nashville nursing home? As of Friday, the Trevecca Center for Rehabilitation and Healing had 55 cases of COVID-19 and 4 deaths.
But consumer investigator Jennifer Krause has obtained emails that raise questions about how that outbreak and others have been handled.
The first word we got of the outbreak at the Trevecca Center for Rehabilitation and Healing came in late April during one of Nashville Mayor John Cooper's daily coronavirus briefings.
17 people there tested positive for COVID-19.
The head of Metro's COVID-19 task force described it as a developing situation and insisted that public health officials,
Once alerted to the situation, contact tracing immediately began.
Had only just learned of what was unfolding there. But emails obtained by News Channel 5 Investigates revealed that a vendor who works closely with Trevecca first sounded the alarm on March 27th, nearly a month earlier, when a nurse at the facility started showing symptoms. The vendor informed the state he'd been told Trevecca would not test anyone, even if they were symptomatic. And that, he added, just does not seem right, clinically or ethically. The state assured him that individuals more closely involved with that investigation had been notified, but there's no record of any sort of investigation underway at that point. Then 3 days later, the state got another tip that Trevecca had announced at a staff meeting that one of its employees had tested positive. Under state and federal rules, long-term care facilities are required to notify the health department as soon as they have a confirmed case or at least 2 suspected cases. But the Trevecca Center did not. Even though the facility had just announced on Facebook they were working closely with local and state health officials. Under Governor Lee's COVID-19 plan, anytime the state learns of such cases, health department employees are supposed to immediately mobilize to protect residents and staff. Now, in an email on March 30th, the head of the division that regulates and licenses nursing homes suggested his team come out to the facility to make sure that they were following protocol. But another email 2 days later from another employee says he still hadn't even looked into it yet. Meanwhile, the vendor was now telling the state that several residents had started running fevers and were placed in isolation. He said it did not appear they were being tested, and he hoped these residents had not been made more vulnerable by the inaction of Trevecca and its owner Care Right. That night, the Metro Health Department got a tip from someone else with ties to the facility, expressing concern about the residents and what appeared to be a serious situation unfolding. The next day, both the state and Metro tried contacting Trevecca, but afterwards, health department workers wrote, "It's clear they're avoiding us. They're being sketchy, difficult to work with. When we call, we get placed on hold and no one comes back to the phone, or we're told we'll get a call back and no one reaches back out." And they were clearly frustrated they were not getting any help from the state health department's regulators, writing, "The state's license group is awful and slow." They said regulators had been notified earlier in the week and still no response, even as the state's chief medical officer called this clearly part of an outbreak and an imminent threat. Finally, after still not hearing back from Trevecca, Dr. Michael Caldwell, the head of the Metro Public Health Department, went to the nursing home himself on Saturday, April 4th, and left his business card asking that someone get back in touch. That night, the nursing home administrator called Caldwell back and confirmed they had 2 employees here who had tested positive, a nurse and a maintenance worker. But the administrator then told the state that the residents all seemed fine. And the facility reportedly resisted efforts to test, even though multiple residents reportedly now were showing symptoms. It took nearly 2 more weeks to finally start testing. And the decision to test everyone took even longer. And by then, there were 45 cases of COVID-19, including many in the facility's vulnerable respiratory unit.
And this is how public health will respond, by performing contact tracing quickly and responding immediately to a cluster of positive cases to contain the spread of this virus in our community.
This is not what happened at Trevecca.
In hindsight, 2020, always think that things could have gone better.
But Dr. Gil Wright with the Metro Public Health Department does not believe there was anything they could have done to stop the outbreak.
They may have had less, but I still think they would have had a reasonable number of their residents become positive.
Jennifer Krause, News Channel 5 Investigates.
Thank you, Jennifer. The administrator at the nursing home said in a statement this afternoon, quote, "The Trevecca Center has followed and is committed to following the evolving regulations put forth by local and state health officials, and we will continue to take all appropriate measures in coordination with local and state health officials." You can read the full statement in the online version of this story.